Toomey speak to what the epi teams are seeing on the ground with them. I'll just tell you, I know some of the things that we've discussed. I think the Albany situation, and she can confirm this, but I believe there was a funeral service weeks ago where an infected person went, and it created this whole epicenter that just exploded down there. I imagine that somebody that was at that funeral works in these facilities and got in there and brought the virus inside, which is, that's one reason we've been begging people not to have, and I know it's a hard thing, religious services, trying to do them online, try to do them drive-in, people staying in their car, spreading people out. Unfortunately, not only in Georgia but across the country, we've seen individuals and churches that are not abiding by that. And I know that's a very tough deal with their congregation and with those faith leaders, because it's tough on me. But we've had other states where people literally had choir practice that practiced social distancing and did everything they were supposed to do, and you still had the whole choir get infected out one of the states on the West Coast, and 2 of those individuals passed away. So that's what we're dealing with, and I think when you look back at what we had in place before, the measures that we had are what the president and Dr. Birch and Dr. Fauci and Dr. Toomey are saying that we've got to continue to do. Don't go out unless you need to. When you go out, practice your social distancing. Use good sanitation measures on your hands, and don't touch your face. Don't do handshakes. Don't, congregate with people. And there may be new guidance that we're going to need to look at with this new situation that we're dealing with. And I know Dr. Toomey and I have spoken to that, and I'll let her address anything she wants on the nursing home.
I think we're learning more every day about this virus and how it acts. As we've talked about, it's a novel virus, it's new. And so we're still learning a lot about how it spreads and what we need to do to protect the community. Nursing homes are probably the highest risk situation we have, short of cruise ships, because you have individuals at highest risk in a congregate setting. And if people come in and out, whether it's visitors or it's healthcare workers, they can bring infection with them. And I think what we've seen is that there wasn't fully, not just in Georgia, all over the country, the full appreciation for how volatile the situations were in congregate settings like long-term care settings and senior centers and other places. We have an FE team dedicated fully to going into long-term care facilities and helping with infection control and ensuring that guidance is being followed. And even as I'm saying this now, CDC is updating their guidance daily. And so I think that we're learning, and as we learn, we begin to look and begin to do outreach and begin to follow the patterns, and we will find more. So we have 47 out of 300. Some, I suspect, we'll find more additional as we become more conscious of spread in the communities.